everyone. Welcome to BVDU MC Quizzing Society. I'm Shruti Rakshay from third year, and I'll be giving you a review over trigeminal neuralgia. So, welcome to anatomy snippets, snippet number 9. So first, I'll give an overview on trigeminal nerve. So the trigeminal nerve is the largest cranial nerve. It comprises of three branches. So two are sensory, while the third one is a mixed nerve. So ophthalmic and maxillary are sensory nerves, while mandibular nerve is a mixed nerve. The trigeminal nerve is the nerve of the first brachial arch. Branches of this nerve provide sensory fibers to the four parasympathetic ganglia. So these include ciliary, pterygopalatine, otic, and submandibular. Now the branches, as I already told you, ophthalmic, maxillary, and mandibular. Now moving on to so now the sensory root arises from the trigeminal ganglia. Motor root arises from the motor nucleus in the pons, and this nerve as such arises from the ventral surface of the pons. Now the ophthalmic nerve is sensory. So ophthalmic nerve is branches of frontal, nasociliary, and lacrimal. Now the frontal supplies the skin of face and skull. Nasociliary supplies skin of face, nasal cavity, and eyeball. Lacrimal supplies skin of face and lacrimal gland. Now the maxillary nerve is a sensory nerve again. It supplies the upper teeth, gums, and maxillary air sinus. Now to the face, it gives other branches such as zygomaticofacial, zygomaticotemporal, and infraorbital branches. So the next nerve is the mandibular nerve, which is the third nerve of the trigeminal nerve. So since it's a mixed nerve, it has both sensory and motor branches. Now the sensory branches include lingual, buccal, auriculotemporal, and inferior alveolar nerve. The lingual basically gives general sensation for the anterior two-third of the tongue. Auriculotemporal supplies the auricle, temple, parotid gland, and the TMJ. Then the inferior alveolar nerve supplies to the lower teeth mental for skin of chin. Now the motor branches, they supply the four muscles of mastication. So the muscles include masseter, temporalis, medial and lateral, pterygoid. The other muscles that the mandibular nerve supplies is anterior belly of digastric, mylohyoid, tensor veli palatini, and tensor tympani. As you can see, this diagram shows you the trigeminal nerve and its three branches and what all it supplies, the areas of distribution. So now this is the course of the trigeminal nerve. So now the trigeminal nerve arises from the motor nucleus, which is present in the pons, the mesencephalic nucleus, which is present in the midbrain, the main sensory nucleus, which is again present in the pons, and the spinal nucleus in the medulla, and the spinal segments from C1 to C5. Now, as I had said before, it arises from the ventral aspect of the pons. And it passes through the trigeminal cave, also called as the Meckel's cave. And then it gives fibers to the trigeminal ganglia, or this ganglion is also called as the Gasserian ganglion. So from here, the nerve divides into three branches: ophthalmic, maxillary, and mandibular nerve. Now, this is another diagram showing the nerves and their course and what all it supplies. So now coming on to our topic of discussion, that is trigeminal neuralgia. So this is basically a sudden unilateral severe brief stabbing pain with recurrent episodes of pain in the distribution of one or more branches of the trigeminal nerve. So out of the three branches, the maxillary is more frequently involved than the mandibular, and then lastly is ophthalmic. Now, these paroxysms are often set off by touching the face, brushing the teeth, shaving, drinking, or chewing. The pain is often initiated by touching an especially sensitive trigger zone over the face. Mainly, it's located if you touch the nose, tip of the nose, or the cheek. The causes of the etiology behind trigeminal neuralgia include petrous ridge compression, multiple sclerosis, intracranial tumors, so at the cerebellopontine angle. Then also AV malformations can cause trigeminal neuralgia as well. Vascular factors, dental infections, post-traumatic neuralgia and infections, and also infections of viral etiology. Now, the pathophysiology behind trigeminal neuralgia is basically when there's a atherosclerotic vessel, so that if it presses over the trigeminal root of the trigeminal nerve, that can lead to focal demyelination of so loss of the myelin sheath over the nerve. So that leads to hyperexcitability of the nerves. So that can cause episodes of intense pain, which keeps on recurring. Now the treatment, so the management includes can be medical treatment or surgical treatment as well. So in medical treatment, the drugs that we use, the most important is carbamazepine. Others include oxcarbazepine, lamotrigine, and gabapentin. Surgical therapy, so that includes microvascular decompression, in which the vessel which is compressing on the, as we've seen in pathophysiology, the vessel which is compressing on the nerve will be moved away, so the pressure is relieved, or the other procedures which can be done. So those include stereotactic radiosurgery, trigeminal gangliolysis, and balloon compression. So this is an overview of trigeminal neuralgia. And the other surgeries that can be done also include percutaneous glycerol rhizotomy and percutaneous stereotactic rhizotomy. And yeah, okay, thank you.